I was fortunate enough to build a new clinic during COVID. And at that time, we bought 8X chairs. They were something that was the top of the line, so it's something that we use. And when I looked in the manufacturer's instructions for use, which you do for any product that you bring into, or any chair or whatever that you bring into your clinic or your office, I noticed that I had to use a certain tablet. Okay, so we followed the protocol. We were testing, and we began to fail. And that is not something that I was used to. My previous experience with the older chairs was actually using a different version of Sterisil straws. So, based on the fact that we were failing, I had to come up with a solution because my patients are all immunocompromised. And so I went to the Sterisil straws. Since I've done that and used the protocol of test, shock, and keep those straws up to date, we have not failed a single test. It's also important to know that you can use regular water. You don't have to spend money on distilled water or sterile water. You can use tap water, and your salesperson, can work with Sterisil, and they will tell you what your total dissolvable solids are, whether you need to use one type of the straw or another type. My experience has been remarkable. When I ran into an issue early on, the salesperson was right there. Just remarkable help. They have expertise that answers questions that sometimes I can't answer. So I depend on the company. It's a great product. And again, we're talking about the safety of the children you treat. We're talking about the safety of elders you treat. We're talking about people who are immunocompromised. You want to have the safest possible environment. You want to reduce your risk, and you don't want to end up in the news for a bad reason. Do the right thing and have the safest visit for all the patients that you see.